There's some relief tonight for hundreds of Canadians stranded on board two cruise ships off the coast of Florida. The ships have been granted permission to dock at Port Everglades. And Global News has confirmed nearly 250 passengers are scheduled to fly to Toronto tomorrow morning. The cruise ships, one of which has confirmed cases of COVID-19 on board, have been desperate to find a port for weeks. Mike Drolet explains what happens next.
The early morning Florida haze turned into midday clarity for 250 Canadians living in isolation on a pair of Holland America cruise ships, including Michelle Perron's 75-year-old mother, Jocelyn.
She's elated. There's a plan. She's got a piece of paper with a plan. And this is the first time in over a week that they've had any kind of direction in terms of what was happening. After 27 days at sea, they've finally been given the green light to come home.
My understanding is they will be flown home on a charter flight.
The Canadians are among 2,500 passengers and crew that were supposed to disembark in Chile on March 21st. But after 4 people died and another 233 showed flu-like symptoms aboard the Zaandam, Chile closed its ports, and the passengers were forced to isolate.
We have cabin fever. Boy, if you want a definition of cabin fever, this is it.
2/3 of the passengers were transferred to a second ship, the Rotterdam, and both tried to dock in Florida, only to be turned away.
We have enough to deal with our folks in Florida.
The reaction was overwhelming. Come From Away trended on Twitter, reminding Florida's governor how Canadians welcome stranded Americans after 9/11. The sequel to Come From Away is going to really suck, read one. And facing political pressure from the left,
we Americans don't turn people away,
and the right, Florida's governor relented, although only Florida residents can stay. And that's perfectly fine for Canadians like Chris Joyner.
So it was, like, to me, a trip of a lifetime. But it's turned out to be a nightmare of a lifetime.
They'll have to isolate when they return, but at least they're no longer lost at sea. Mike Drolet, Global News, Toronto.
The U.S. now has more than 240,000 confirmed cases of COVID-19, and more than 5,700 people have died. The economic toll is becoming more and more clear. In the last week, 6.6 million people filed unemployment claims. In the span of 2 weeks, 10 million jobs have disappeared. Jackson Proskow has a status report on where America is at right now.
In cities across the U.S., they're preparing for what's to come. New field hospitals are under construction in convention centers and stadiums in every corner of the country. Everyone fears they'll be the next New York, where hundreds of new deaths were reported overnight. It's so bad, paramedics have been told not to transport unresponsive patients to the hospital if they can't be revived in the field. Medical supplies are now critically low.
We have about 6 days of ventilators in our stockpile.
Get me pads and a board now.
Hospitals everywhere face the same shortages. The U.S. national stockpile is critically low, too. States say the thousands of ventilators on order will arrive too late. There's little sympathy from Washington, where President Trump tweeted a message to governors and hospitals. We are a backup for them. The complainers should have been stocked up and ready long before this crisis hit.
What do you see as the greatest failure of the U.S. response?
We spoke with Jeremy Konyndyk, an expert in pandemic preparedness.
I think the greatest failure, and it's really the failure that everything else derives from, was the failure to take this seriously in late January.
Today, the U.S. is bracing for a predicted 100,000 to 240,000 coronavirus deaths. That best-case scenario may not be achievable. Some states are only now implementing stay-at-home orders, having waited until their case numbers and fatalities started to climb.
If anything, it's possible that we may see more cases than those models project. Obviously, I hope we don't. But what's clear is there are a lot of parts of this country that are on a similar trajectory to New York.
In a sign of how rapidly things are now changing in the U.S., public health officials are broadly recommending that Americans cover their faces when they're out in public. They say a scarf or a homemade mask is all that it could take to slow the spread of coronavirus. At this point, they do not want people wearing surgical or medical grade masks because they're in such short supply. Donna?
Jackson Proskow in Washington, thanks. Many in the U.S. now realize political leaders there have not acted fast enough. New cases have quickly outpaced some of the world's hardest hit countries, including South Korea, which reported its first case on the same day as the United States. America has been slow to test and slow to order people to stay home. Political leaders are fighting over precious medical supplies now. That's a sharp contrast to the Team Canada approach here. It's not perfect here either. We have shortages too, and people are dying here too. But as Eric Sorensen explains, we're in a better position than our neighbors to the south.
Closing the border may prove to be a blessing for this country.
The virus.
For weeks, the U.S. president downplayed the risk.
By April, in theory, when it gets a little warmer, it miraculously goes away. I hope that's true.
Even when Donald Trump acknowledged the seriousness of COVID-19, many state governments held off stay-at-home policies. New York Times analysis of cell phone data tracked Americans' travel last week. In New York State, virtually none. In many states, still lots of travel. From devastated New York came this warning.
Look at us today. See yourself tomorrow.
In Florida, where so many Canadians spent time in March, beaches for a while still teemed with people. They eventually closed, though the governor only issued a statewide stay-home order on April the 1st.
See, people thought Easter, all that. That's not going to happen.
In Canada, the crisis struck and governments of different stripes mobilized together.
Stay at home.
Stay in your homes.
All levels of government, including mayors, got on the same page.
Every single one of us, stay home.
And the streets here largely emptied. Canada and the U.S. were on different paths. Through the middle of March, the number of cases in the United States was outpacing the number of cases in Canada at about 10 to 1. That makes sense in terms of population. But by the end of the month, Canada had moved up into the low thousands. The United States had skyrocketed from there. The U.S. now outpacing the number of cases in Canada by 22 to 1. A full-blown crisis is now underway south of the border.
I hope we can do this by Easter.
It didn't help Americans weighing the seriousness to see the White House forecasting an early end that its own experts would not predict.
Obviously, no one is going to want to tone down things when you see what's going on in a place like New York City.
I'll have Dr. Strang answer that.
In Canada, political leaders have consistently deferred to specialists.
I'll see if Dr. Tam has an additional comment.
The medical experts have become the voice of Canada's pandemic policy.
Medical masks, respirators must be preserved for health workers.
The federal government and the provincial governments really were key in scaling up preparations for this infection earlier on compared to the United States.
Canadians are not out of the woods, but we can also feel for our American neighbors and the sheer scale of the catastrophe they now confront. Eric Sorensen, Global News, Toronto.
Jeff will continue to consult with experts and try to answer your questions. Send them to yourquestions@globalnews.ca. And on our website, you'll find a special page dedicated entirely to COVID-19. That's at globalnews.ca/coronavirus.